to start us off today, we will be, as we titled this today, a global perspective. We want to give different voices to, what's going on all over the world. So Alice Zhang, who many of you have worked with, she is our communications officer for Shot at Life, where she oversees the communication strategy, creative asset development, and digital and social media marketing. Prior to joining the United Nations Foundation, she led media relations and content strategy for an international NGO. And her work has taken her from working with Fortune 500 companies in Silicon Valley to launching an entrepreneurship center from the ground up in the hills of Peru. Alice has a bachelor's degree in journalism from Northwestern University and is currently based in Washington, D.C., where she just moved a month ago. And she will be interviewing Nashilongo Gervasius from Namibia. She's a digital policy researcher, media and communication specialist, and trainer. She is the founding president of the Internet Society Namibia chapter and is an advisor to the Namibia National Working Group on Internet Governance Forum with interests in technology policy, media development, and development. She is a Plus Social Good connector with the United Nations Foundation, how we got connected with her, and she's working to promote the SDGs and is an Open Internet Leader Fellow for 2020 and 2021. She was recently appointed by the President of Namibia to serve on the Presidential Task Force on the Fourth Industrial Revolution, where she chairs the Subcommittee on Infrastructure and National Data. She is the director of NAMCHU, I wish I would have gotten that pronunciation, a digital public policy, communication, and tech hive that consults on technology policy, media, and communication development. Nashilongo holds a master's in ICT and the Knowledge Society and has just completed a Master of Science in Global Media and Communication at the London School of Economics and Politics. And she's a mother of 4 children and a wife. So with that, I will turn it over to their interview.
Thank you so much, Nashilongo, for joining us today. We're really excited to have you talk to our advocates here at the Mobilize to Immunize conference. We just heard a little bit about your background and your biography from Ali, but I was wondering if you could just tell us in your words, what do you do? I know we got connected to you through the Plus Social Good community and would love to hear more about it.
Thank you. Yes, and it's a pleasure to be here today and engage you on this wonderful work that you guys at Shot at Life are doing. So I, as part of the UN Foundation Plus Social Good connectors, we amplify the Sustainable Development Goals from wherever we are located in all throughout the world. We are 13 at this point. Of particular interest, I work on SDGs related to technology and innovations, but also education. Personal favorite of mine is gender. I can't disconnect with gender, which is SDG number 5, wherever I interact. So we work anyway. We are grassroots work, or we involved in grassroots work on the SDGs within our own localities. For me, in Windhoek and in Namibia, I've been doing a lot of work on technologies from a policy, really at policy level, engaging in policy consultations, policy recommendations to make sure that the internet is safe and it is trustworthy and it is available for everyone else. I think my introduction has summed that up. And like I've mentioned, I'm also very passionate about partnerships and collaborations as part of SDG 16. Is it 16 or 17?
Yeah, that's really important work, both on the technology side, that's obviously cutting into so many different sectors of life nowadays, including in the global health space, as well as, partnerships are key, right, to working together and tackling some of these really difficult issues. So I know on top of your work to promote an open internet in Africa, you're also a mom. So can you tell us a little bit about your family and your children?
Thank you. Yes. So I'm a mom of four little ones, so big ones. My oldest is 8 and 6 and 4, and my youngest is turning 2 in December. Yeah, it's an amazing role. It's I think the most important almost role to society in bringing up children and making sure that they're safe and they're protective. Yeah, and mostly related to, maybe if we could talk about immunization. I was very fortunate to be in a middle income country, so to say, where vaccines like, you know, your polio, measles, rubella, like your very basic but also global vaccines are available, and they're compulsory for all children. So that to say that the primary public health sector here pays a lot of emphasis in making sure that you know, as many children and families are protected from especially childhood illnesses, and immunization is key in that role. Yeah.
Yeah, definitely. And that's great to hear that, you know, you were able to access those really important routine immunizations for your children. That being said, we know that there is a lot of, you know, inequality kind of throughout the world, but also in that experience. You know, have you heard stories or know of maybe challenges in other places? Or yeah, do you remember kind of some of those experiences as a young mom?
Yeah, I mean, for myself, I'm at least fortunate enough to be able to afford and access vaccines, but there's so many people in my country, that even in the city where I live, who can't access vaccines for a lot of reasons. One is just even just taxi fare or transportation to get to a public health facility. I mean, for us, of course, our transportation system is very, very different from what you guys have in America and also other places in the world where our participants that are taking place in this conference today are from. So you're really looking at a lot of challenges, just accessing the public health facilities, but also a big challenge is also the cost. When you get to the hospital, there's usually a fee to do that. And if it's not a national campaign, or if a child is behind with other immunizations, you'll be asked, for instance, to pay. And sometimes that can be a very stumbling block, especially in a country where unemployment is very high, and there's a high income disparities amongst others. The other is also for a lot of moms is just having documents, like having a birth certificate or a national ID for you as a mom, but also a birth certificate for your child. Sometimes those have been also challenges for you know, a mother to take their child to hospital, because obviously when you get to a public health facility, there needs to be some records, and so if you don't have a birth certificate of a child, it becomes very difficult for you to get to the hospital because that needs to be recorded. So a number of challenges, but also because our country is very wide and it's very rural. It has a very rural background. For instance, where I grew up, in the rural north of Namibia, it's the distances are so very high, but it also becomes like contestation of priorities, right? My grandmother or even my mother at that time will have to think about, do I have to take time to get to a clinic, or should I get plowing and making sure that the goats are around and everything is safe, or I have went to go pound the millet so that there's food in the house. It's a whole lot of issues that stands as barriers to accessing vaccines all in total. Yeah, but I think generally most of importance is that, you know, government makes all efforts, at least where it can be, but despite those many challenges as highlighted.
Yeah, definitely. Thanks for sharing. And I imagine a lot of those same barriers have kind of translated over to what we're seeing now, with the COVID-19 pandemic also. So I think the latest statistic I saw was that, less than 4% of Africa has been vaccinated against COVID-19. So, do you think there are some unique challenges around that as well? Or, what does that statistic look like in reality?
Yeah, so yes, those statistics are very, very representative of the situation in Africa. And that obviously also translates into some of the challenges that we see with COVID. So with COVID, we're dealing with a whole lot of issues here. Obviously, you've seen me speaking about misinformation, possibly at some other platforms. That's one of the challenges. Now I'll delve into that later. But also a whole lot of misconceptions that is related to misinformation to accessing and actually accessing the vaccines in Africa. And on top of that, it's also just the availability of vaccines and the general lack of knowledge about COVID. And I think the issue with COVID was that it was a very new virus, but despite that, people already knew about vaccines. I mean, and vaccines. So there's a whole lot of hesitancy to getting people vaccinated. And I think that generally that's the number one for the African community. And I don't want to speak for everyone else, but at least within my country, people aren't very sure, how safe is the vaccines. And it is not because that information is there. It's not there. It's because of misinformation and misconceptions that were created about this virus and COVID in general. So you're talking about, some of the very weird misinformation has to do with this vaccine is going to change your DNA, for instance. So as a family person who is a mother, remember we think about as maternally, like thinking about your future. You want to see your grandchildren, and you've got to think about it. And I think some of those messaging, which is really negative, has got to the people, and that is the major cause of vaccine hesitancy. On top of that, there's also there's just no vaccines available in the country. I'm sure you have heard about vaccine, what is the term? Is it vaccine colonialism or something like that? That the Western world or the developing world has sort of bought up all the vaccines that is available. In fact, they even bought in future that us in the third world countries where funds for buying the vaccines as a country could be very limited. And even the little ones that get through from, maybe partnerships with your WHO or the CDC office here in the country, does not cover as many as people as possible. For instance, our vaccine penetration in the country right now is, I think, 10%. It's like 230,000 people whole country. And that's because for a long time, we didn't have vaccines available. We've got some coming in from, say, China or Russia, or the AstraZeneca from the US, from Europe. And right now, I think we received some from the US, Johnson & Johnson, and we've received another one as well from the US. But even that, it isn't getting to as many people as possible. If you remember, Namibia had like the worst cases throughout the world in July. We were recording about 3,000, or is it 1,000 rather, maybe 300 deaths a day. And for our population, that is very, very, that's a big number, because we are like 2.5 million people within the country. So there's so many other challenges. But again, you found out that while people were so used to, when I give birth in the hospital. It's my child must get all the vaccines at birth, and if I have documentation and I have access to come back in 6 weeks, they must also they are entitled to that vaccine at 6 weeks, at 12 weeks, you know, and so it goes. But with COVID, that sort of changed. The information, for instance, regarding the effect of having COVID as a mom, and maybe you are breastfeeding amongst others, or you have a small baby. So all of that information needed to be very clear, to be cleared very fast and earlier, but it didn't happen. So for instance, I was breastfeeding this whole time, and I hope it's fine if I speak about breastfeeding, because I at least I had the honor of being able to breastfeed my children. But I wasn't sure whether the vaccine that I thought was the safest for me, because at times I get an opportunity to travel here and there, and I needed to get a vaccine that is you know, that is safe for me and is recognized wherever I will travel. For a long time, I wasn't sure that I could be vaccinated and it was safe, even though I was breastfeeding. So a lot of that information needed to be broken down as fast as possible and get to the people so that they can make the decisions. But again, misinformation and disinformation was like a stumbling block, and that prevented people to get access to vaccines. Yeah, I'll end here, and then we can take up the conversation as we go.
No, that's great. And I appreciate you, kind of giving some light, into the situation there, because, it's been frequently said of the pandemic that we had a lot of existing inequalities throughout the world, and the pandemic has only made that even worse. So especially, you were saying earlier with vaccine nationalism, we've all had very different experiences of the pandemic just based on our personal lives, whether we're students or teachers or nurses, but as well as just where we live and the availability of vaccines near us. So, as a lot of our advocates are going into, a 6-week push to raise awareness for the importance of vaccines, as well as talk to their policymakers about funding these important programs, is there anything that, you would want them to know to kind of take into these meetings and take into their advocacy?
That's a good question, Alice, and thank you. I think the most important point, or most important advocacy point that our advocates and all moms out there should need to know is that to make sure that the vaccines are available and they are accessible. I understand in the US that you can walk into a pharmacy, which is like a medicine shop, and get vaccines. But vaccines also needs to be affordable. Where they are available at a cost, they need to be as affordable to people, and that they are the way they can be used or accessed is in a language as basic as possible, that people interacting with it or needing it understand clearly. From the US, I think what we are seeing is that the CDC is doing a very good job in getting the information out there and getting the information out to the public, and getting enticed, people getting enticed to vaccine. What the challenge is that, for instance, is that there's children who have to go to school, and we saw cases of children rising, especially in the US and other developed world. So it's really to speak to their policymakers, for instance, to ensure that those masks must remain enforced for children. And that's something we are observing from here, that, for instance, US lawmakers are very hesitant about, or they are sitting on the fence about, or it's like a decision that nobody wants to make. It's important that we keep our children to be safe, because we are here today, we are advocating, but who advocates tomorrow if our children aren't safe, if they aren't protected. I think advocates should be rallying behind to make sure that the children are vaccinated. That vaccine is not happening in Namibia, and for a long time possibly we are going to be having our children not vaccinated for a longer period, because again we don't have that access. So if moms, advocates out there have access to vaccines for their children, let's ensure that the children are safe, but also as moms that we vaccinate ourselves, because I personally had to get COVID. I want to suspect that it's my children who brought it home from school. At that time, we didn't have the vaccines available here as well. So if our children are safe and they're vaccinated, if we are vaccinated, we get safe, and so our families are safe. And when our families are safe, our communities are safe. When our communities are safe, our country is safe. Like we all together we become safe. I mean, there's a lot of politics going on about vaccine. You don't have to be engaged in policy to see for you not to see your child, for instance. You don't want to see your child dying of COVID, or your husband or your family member dying, for you to first believe that COVID is real, or that this virus is as serious as death. I mean, there are cases, there are numbers in here in Africa, but also in the US, where people are dying of COVID. This is a serious disease, a virus. And so if you have access to a vaccination, you cannot delay any other time, but to access it and be safe for your family. Your children need you, your community needs you, your job needs you, your country needs you to serve and to advocate. And also that speaks to fellow advocates, that we need to be safe, that it's not just for us to tell people to get vaccinated, but also for ourselves to be vaccinated as well.
Yeah, definitely. And that's, even on top of just COVID-19, right? I always say vaccines are the closest thing we have to a silver bullet. And for so many diseases like polio and measles and pneumonia and rotavirus, the ones that we talk about the most in our advocacy with Shot at Life, like there's a vaccine out there that can prevent a lot of these deaths and just suffering, that people don't have to go through. So, thank you so much for sharing your perspective with us. And we really enjoyed having you today and just listening to your perspective. So thank you for all your work that you do to advocate, not just for vaccines, kind of through the misinformation, tackling misinformation lens online, but also in your work to, build a better future for future generations and for all of us to live a healthier life. So thank you so much again.
Thank you, Alice, and thank you to the Shot at Life team for having me. I'm pleased to be here. Yes, thank you.
Great. Oh, there we go. Thank you so much, Nashilongo, and thank you for joining us today. I know you're here live with us, so if anybody has any questions, feel free to message Nashilongo, put them in the chat. Unfortunately, because we don't want to keep you guys too long, and we want to make sure that we are respectful of your time, we are going to be moving into our global health content. So talking a little bit more specifically about our diseases and kind of the current global picture. So, sorry, I'm pulling this up. So we will get started with remarks from Ambassador John Lange. He's the Senior Fellow for Global Health Diplomacy at the UN Foundation and is the primary focal point for global health diplomacy activities and its wide-ranging work with the World Health Organization. He chairs the leadership team of the Measles and Rubella Initiative and earlier served as co-chair of the Global Polio Eradication Initiative's Polio Partners Group. Prior to joining the UN Foundation, he worked at the Bill and Melinda Gates Foundation. And before that, Ambassador Lange had a distinguished 28-year career in the Foreign Service at the U.S. Department of State, where he was a pioneer in the field of global health diplomacy. He served as the Special Representative on Avian and Pandemic Influenza, Deputy Inspector General, Deputy U.S. Global AIDS Coordinator at the inception of the President's Emergency Plan for AIDS Relief, and U.S. Ambassador to Botswana. Following his remarks, we'll be hearing from Elizabeth Thrush and Lori Sloat, and they will be open to questions at the end. So Elizabeth Thrush is a polio advocacy officer on the global health team, providing advocacy support for the UN Foundation's polio and broader immunization portfolios. Prior to joining the UN Foundation, Elizabeth worked on the immunization team at the Pan American Health Organization, regional office for the Americas of the World Health Organization, providing support for countries of the Americas on immunization and surveillance activities for polio and other vaccine-preventable diseases. Elizabeth holds a Master of Public Health degree focused on global health and behavior change communication. And Lori Sloat is the Senior Director for Global Health at the United Nations Foundation. Prior to her work at the foundation, Lori was the Deputy Director of Advocacy and Public Policy at Gavi, the Vaccine Alliance, for 4 years. She also worked with the World Health Organization for nearly 10 years, working with ministries and partners and advocating for global campaigns around various health issues. She has worked with other UN agencies such as UNESCAP in Bangkok and UN Ops in Vietnam, promoting the work of pro-poor public-private partnerships and capacity-building initiatives. Earlier in her career, Lori worked in Mozambique with an NGO on a health and sanitation program through a social mobilization effort with rural communities. Lori has a master's degree in intercultural and international management from the School for International Training in the United States and has studied economics and development at the University of Nice, France. So with that, I will turn it over to Ambassador Lange. And then after that, we'll be hearing from Lori and Liz.
Hello, Shot at Life Champions. I'm very pleased to be with you by video today. I'm Ambassador John Lange. I'm a senior fellow for global health diplomacy at the United Nations Foundation. In my role at the UN Foundation, I chair the leadership team of the Measles and Rubella Initiative, which UNF is a part of. And I have in the past chaired the Polio Partners Group of the Global Polio Eradication Initiative. You all know the importance of vaccinations. And you can just look at what has happened when people have been vaccinated and the big successes that has generated. When the World Health Assembly in the year 1988 decided to eradicate polio, there were 350,000 cases a year. Last year, 2020, there were 140. And this year, there are just a very small number of cases. For measles, 23 million deaths have been averted through the measles vaccine since the year 2000. And you look at the current concern of all of us, COVID-19, and you can see that high levels of vaccinations have resulted in great drops in the number of people dying from COVID in the countries that have been able to implement those vaccinations to a large number of their people. But we also all know that challenges remain. I remember several years ago visiting Angola and going to a suburb of Luanda, the capital city. And a small number of us were visiting a family where the 2-year-old, a small boy, was paralyzed from polio, starting to show that paralysis and would suffer it for the rest of his life because there is no cure for polio. And you can look at measles, where even before COVID, in the year 2019, the number of deaths from measles was over 200,000. And you look at COVID and the number of people dying every day from COVID. We have challenges, we have to meet those challenges. And COVID, of course, has disrupted health systems and disrupted immunization systems as it devastated the populace of country after country all over the world. We're really at a very interesting, probably unique point in history right now, because the world is really focused on global health primarily in terms of pandemic preparedness and response. And at the same time, other health programs, including immunization programs, have suffered because of this pandemic. And what we need to do now is to respond to the pandemic that currently exists, prepare for future pandemics, and very importantly, continue and build up immunization programs and other global health programs so that people all over the world can lead healthier lives. This is not easy to do, but I think we are on the verge of doing it. On September 22nd, President Biden initiated a global COVID-19 summit that was really pushing countries and international organizations to do more to vaccinate those in the developing world, because the lower and middle income countries have had far less access to the vaccines than the rich countries. And there's, in all this discussion of improving global health security and improving pandemic preparedness, it's been very important to keep in mind how immunizations are critical for this, because you really cannot have a secure populace without having high levels of what is called routine immunization, so that the people do not suffer from maladies that hardly exist in the United States and other developed countries. With that in mind, it's really important at this point to be an advocate, because in all of this discussion of the global health concerns, it can easily get lost that immunizations are a fundamental part of global health security and a fundamental part of being prepared for future pandemics and future health emergencies. That's why your work as advocates is so important. The US government has historically been a strong supporter of global immunizations, both in the Global Polio Eradication Initiative, in the Measles and Rubella Initiative, and in many other global health programs. The US government, through the Centers for Disease Control and Prevention and through the US Agency for International Development, is a leader but needs to be prodded, and especially the Congress, which has the purse strings, as we all know, because we have to keep up the immunization effort, we have to keep up efforts to improve global health security. I know you'll be talking a lot more about global health with some of my UN Foundation colleagues and others, and I wish you well in those discussions, and I wish you well in your advocacy efforts. Thank you, champions.
All right, Lori and Liz, I will let you take it away.
Thanks. Hi, everyone. It looks like I might be having problems with my video, but just checking to see if you can all hear me.
Yep, I can hear you.
Okay, well, that's unfortunate about my video. I'm not sure the technical glitch there, but hopefully it can come online. I've sort of put my camera on, but it's not allowing me, it looks like. But really, I just wanted to start off by adding on to what Ambassador Lange has said about thanking all of you really in your role in advocacy for immunization. So hugely appreciated. And one of my main points I wanted to convey here, knowing that you all are working with congressional staffers, Congress, and other stakeholders, is really to be aware and to feel part of a movement that's taking place. Many of you may be aware of this or not, but there's something called the Immunization Agenda 2030, which is essentially a global vision that sets out targets and goals. And there is a huge movement of people, ministers, everybody involved in this so that we can all reach some of these goals. Not so important to remember what these goals are because you're all working already on so many of the issues, but just as one example, over the next 10 years or a little less than that now, is to cut in half the number of kids who've never been reached by vaccines. So that sometimes you'll hear this referred to as zero-dose children. But it's also in some of the basic immunizations that you all have previously worked on, with measles and polio and rotavirus and pneumococcal, it's to reach 90% of children worldwide in those vaccines as part of those goals. But really, like what I wanted to talk about a little bit was that recently at the UN General Assembly, there was quite a big event around immunization agenda and this whole aspect of how do we deal with the need to have a dual response to COVID-19, as well as ensuring that we don't slip further back from basic immunization. And so it was really a wonderful way to show the community of what the ministers of health and finance and development are doing. There were several ministers that joined. Civil society groups like the International Federation for the Red Cross. There was a really powerful advocate from the Geneva Learning Center, a woman named Charlotte from Cameroon, who, you know, at the start of COVID was looking for materials and information. And she started a network of over 6,000 immunization professionals from across the world, where they now are part of a community of practice and are learning from each other's experiences in various countries and how they use that information to address their communities. You know, we had the head of an organization called Village Reach in DRC working on polio integration and the work there in COVID. And a Senator Etinyazova from Uzbekistan, to talk about the importance of, not the dual response of COVID-19 vaccines, but as well as not backsliding on the basic immunizations and strengthening of health systems. And her work with the Interparliamentarian Union, which is the worldwide Congress, essentially, of parliamentarians from all over the world. So just really wanted to convey that this is something, as we're moving forward and looking at the COVID response, how are we ensuring that we set our goals and can meet some of these challenges by 2030? And as Ambassador Lange said, so this means we need to prepare for the next pandemic, respond to this one, and again, address that basic routine immunization. And really wanted to as you think about talking to the congressmen or staffers and other stakeholders, to really, almost give yourself a pat on the back a little bit, and the work that you've already laid and the groundwork in advocating for immunization, and how that has led to the U.S. leadership role that it has in terms of laying the groundwork and the good work that's helped to pre-position countries to respond to COVID based on some of those immunization activities that have taken place. So just as an example of that, Ambassador Lange mentioned the CDC's role, and that Congress has the purse strings for CDC and USAID to sort of help with these global immunization programs. And one of the things that's really quite remarkable is that, through CDC support, as an example, they fund and work with over 900 measles, rubella, and polio labs in the world, including in countries like Nigeria and Pakistan, but elsewhere. And, really they have about, I'd say something about 2,200 participants in over 78 countries working on these activities. And all of these people, resources, assets were used to help respond to COVID. So while the polio measles infrastructure was there, they were able to sort of pivot the use of those labs and personnel to help respond to countries all over the world. So a very good example of how, using and leveraging a basic routine immunization system to help with the response for COVID. But we do need to continue to do more. And so it's a critical time to scale up for the COVID vaccine rollout, and also halt and reverse some of the declines that we have seen in 2020 in basic immunization. My colleague Liz is going to talk a little bit specifically around the 4 diseases in which you're all engaged, but just kind of from an umbrella point of view, looking that, unfortunately, because of the pandemic, 2020 did see one of the first significant slips in childhood vaccination rates in decades. So unfortunately, there was 17 million kids who did not receive any vaccines at all. And those are the children that we refer to as zero-dose kids. And this is an increase of about 3.5 million children compared to 2019. I'd say that I would like to highlight that the challenge is universal. This is an issue grappling in high-income, middle-income, and low-income countries. Again, this dual response of how do we address COVID response, but as well as ensuring the basic routine immunization. So the COVID vaccines is the top priority, obviously, for countries everywhere. But we just really want to ensure and sort of enlist you as advocates that we are not shifting human and financial resources away from basic health services, including the routine immunization. And that's a message we would love for you to help us advocate with in the years to come. And just that the continued investment is critical. So again, just to say that your role in this through advocating and members of Congress to continue investing in immunization is really just so hugely appreciated. And looking forward to the Q&A session as well, if I can address anything that you have questions on. But for now, just over to Liz to talk a little bit about some of the impact this has had on the diseases in which you're all engaged. Thanks so much.
Thank you, Lori. Hi, everyone. I'm Liz. This is my third fall conference with Shot at Life Champions and fifth overall. So I've had the pleasure of meeting some of you in person, and others of you I hope to meet in person when we can have these in-person conferences again. So, I don't need to tell you all this, but vaccines are one of the best health investments money can buy. And as Ambassador Lange spoke to in his opening remarks, and I know you have the details in your leave behind materials, but there's been incredible progress, and especially on the 4 focus diseases for Shot at Life. So for polio, 99.9% decrease in polio. So that means that Ambassador Lange had mentioned that when the global polio eradication started, there were 350,000 cases every year of children being paralyzed from polio. And today, vaccines have prevented over 18 million 18 million people are walking today who otherwise would have been paralyzed from polio. And the progress now is last year in 2020, there were only 140 cases of polio. And this year in 2021, when we're discussing the wild polio virus, there's only been 2 cases. And there's been a few more of the other type of polio called VDPV. I'll get to that when we speak about the challenges in a second. But there's just been incredible progress on polio and measles. The measles vaccine has saved over 23 million lives since 2000. The pneumococcal vaccine has helped reduce childhood pneumonia deaths by 67%. So previously, in 1990, it had been 2 million every year. And now that while we still see childhood pneumonia deaths, it really has been reduced. We're still seeing an average of 600,000 every year. But that decrease has contributed to an overall decrease in childhood deaths by 50%. So vaccines really are just the best public health investment. For diarrheal diseases, the rotavirus vaccine has helped prevent childhood hospital admissions by over 40%, and every year saves around 29,000 childhood deaths. The exact numbers of estimating the exact number of lives saved is sometimes hard because it's a preventative thing and not all of those details can be calculated, but it's about an average of 29,000 deaths every year prevented from just the rotavirus vaccine, which is a drop in the mouth similar to the polio vaccine. However, all of this progress really is at risk. But as Lori was explaining, 2020 was not a good year for global immunization. However, I believe Ambassador Lange had mentioned this, we're at a unique opportunity. So while 2020 was the lowest vaccination coverage in over 2 decades, and millions more children are vulnerable to these diseases, we're also seeing an opportunity that if we can manage this pandemic correctly and invest in these health systems that everyone realizes are so valuable, that we have an opportunity to regain that lost ground. So for some of that lost ground and what's at risk, for measles, Lori was mentioning about how it's dropped for vaccination coverage. And it's dropped to the lowest since 2010 for coverage. The last time it was at an 84% coverage was 2010. And that's when we're discussing the first dose of measles. The WHO recommends that children receive 2 doses of protection. And when we talk about the second dose, an additional 18 million children did not receive their second dose. So that's 22 million didn't receive any, and 18 million didn't receive the second dose for full protection. Polio is also really at risk because while there's been a lot of progress, it's really key to make sure every child's vaccinated, and vaccine campaigns have not been able to occur in many places because of COVID. In 2020, there was a 4-month pause where no campaigns occurred. And while many have occurred since then, there's still today 46 countries with postponed campaigns for vaccine preventable diseases because of COVID. So while some campaigns are happening, it's still preventing. These disruptions are ongoing, and we're going to continue to see disruptions from COVID on routine immunization and campaigns. And that's why we really need to advocate now for continued investment. So the pandemic is affecting all income levels of countries, high income, middle income as well. The low income countries are really experiencing the biggest setbacks, and they're being faced with a lot of choices of COVID-19 vaccination and rollout and other primary services unless support is mobilized. So we really need to leverage this moment of opportunity where the whole world is aware of the importance of vaccination and preventing diseases, and not just sustain the budget lines, but increase them. And that's why your support as advocating to Congress is so critical, especially right now, because while COVID-19 has been the biggest threat to our progress on vaccine, it also is a really huge, huge opportunity. The pandemics really reminded the world of the power of vaccines to fight disease, save lives, and ensure that every child everywhere is protected from these preventable diseases. So your support is absolutely critical. The US government is a strong supporter of immunization, but we need to make sure that that continues that way, and that we're even asking for additional funding to make up this lost ground. You have all this information, your leave behinds, and I know you're well prepared for that. So I just want to thank you guys for everything that you're doing, and just encourage you to keep advocating for global immunization. So I believe now we have time for questions. So please, we welcome any of your questions.
Yes. So if anybody wants to come on screen and ask your question, feel free to just request to share your audio and video, and we'll bring you up. But I see right now we have a question from Cynthia. Thanks for joining us, Cynthia. So she said 46 countries with postponed vaccine campaigns. That means no vaccine distribution at all since the onset of COVID-19 in spring of 2020, ?
So that's a good question. And so it depends, right? So it's basically where sometimes there's campaigns that are made up to, like a makeup campaign, right? In terms of reaching certain communities with measles and or polio, right? So quite often in the missed campaigns, it's sort of campaigns that were planned for sort of catch up for measles or polio. So it does not necessarily mean for all vaccines. It's kind of country dependent. So, but it's a good question. And I think in terms of the routine and immunization numbers missed, it's harder to get at that information, frankly, but these are sort of more on the planned campaigns and sometimes routine immunization. But I don't know if Liz also wanted to comment on that, but generally those figures are for specific vaccine campaigns.
No additional comment. I think Lori covered it, but if that clears up your question, Cynthia, if not, happy to clarify anything else further.
And if there's any other questions, we still got a few minutes left. So we'd be happy to bring you on camera or answer them in the chat. All right. Well, if you guys don't mind hanging on, I mean, if folks want to start jumping off, if there's no questions that you have, if anybody wants to hang on for a few minutes and maybe ask a question without so many people around, I know we have Liz and Lori on scheduled until 1. So if anybody wants to hang around and ask anything, but if not, thank you all so much for joining today. Hopefully we'll be seeing you tonight at 7 p.m. Eastern, We will be talking about how to talk about vaccine misinformation in your community and to Congress from a great nurses panel. And we will also be then moving in and talking about our specific asks. So make sure you don't miss that tonight. We'll have Brian joining us to break down, Congress and Capitol Hill and kind of where everything stands right now. And I see Kara asked a question here. How would you explain to a member of Congress that the global childhood immunization line items support COVID-19 response and preparedness?
I can add to a little bit, and then maybe Lori has something else to say on that regard. So supporting these programs, especially polio and measles, is also supporting the COVID-19 response. Polio infrastructure has been a huge part of the COVID-19 response and recovery, and also preparing vaccine rollouts in country, especially in these most vulnerable countries where the polio infrastructure is stronger, it reaches farther than other health programs right now. So polio staff have been used to support surveillance for COVID, testing, training, social mobilization, educating communities on hand washing, on what to do if you are sick. And the polio staff has also, the laboratories have been used for testing, and also measles staff and laboratories as well have been used. So supporting these programs has supported COVID-19 preparedness and response since the beginning. They were some of the first responders on this, and it'll continue to respond because these programs, strong immunization systems, are part of strong health systems, and strong health systems are better prepared for pandemics. Polio has also supported previous outbreaks such as Ebola, yellow fever, and will continue to do so as long as there is continued support.
Great answer. Nothing further to add. It's just, and if you're speaking with Congress, it's sort of a big thank you. Thanks to your investment in being a leader in this, we were pre-positioned in many countries to be able to respond to emerging outbreaks like this pandemic because the infrastructure and the investment was already made. So really, it's a big, huge validation of the importance of the investment in which they're already engaged. But we do need more investment because we want to make sure that, as Liz said, as the polio and measles resources are being used, we still need surge capacity, right, for that extra COVID response, or else we're not going to be able to continue with the measles and polio needs as well, right? So while it's been hugely appreciated as that investment already being in the countries, we need to make sure that there's this surge of funding so that we're not, inadvertently drawing from existing resources that we continue to need for the basic immunization programs.
Great. Thank you both so much for that answer. And I see we got another question from Linda Brown. Wasn't Afghanistan where the polio cases developed most recently? Now that the Taliban has control, how do you anticipate that will affect vaccination efforts?
Sure, I'd be happy to say a little bit about that as well. So with the Taliban control of Afghanistan, I've heard the term that the cautiously optimistic. The Taliban has voiced that it is not against vaccination, and it wants to show that it's supporting these initiatives they're trying to show that they are behind vaccination. Of course, how that will also play out in reality is yet to be seen. So I don't think we can expect that there will be no problems, but they have said that they will support house-to-house vaccinations, which is actually something that before in the Taliban-controlled areas of Afghanistan, which there were quite a few areas of Afghanistan already controlled by the Taliban. Previously, they did not allow the polio program to enter and do house-to-house vaccinations. They were not against vaccination. They required vaccinations to be held at the health centers or at the mosque. They wouldn't allow house-to-house. And we've learned in the polio program that house to house is really the best way to reach every child. And every child does need to be reached to get to polio eradication. So there are Taliban representatives working with the polio program, and it's yet to be seen how that will play out. So I'm not sure if that will be, I'm not sure how it will go out, but I hope that it will be okay.
And maybe just to add to that in terms of words of encouragement, I mean, obviously it's a tough situation, right? I mean, and as watching all of this unfold, and so it's how to work with the current administration in Afghanistan. And the WHO Director General, Dr. Tedros, went, I believe it was September 21st and 22nd, and visited the Afghanistan, the new government. And was very encouraged to hear, that they're so focused on essential health services and how to get essential health services to the communities, right? Because we really want to make sure there's continued outreach to the communities, given the situation. And as a further sort of ray of light, I suppose is the best way to put that, there's ongoing work being done by WHO and UNICEF staff. And so the chief of immunization for UNICEF, who is in the country in Afghanistan, has recently met with the new Minister of Health and the Deputy Minister of Health, where the Minister of Health expressed his interest and support for partners to please do integrated campaigns for polio and measles, as an example, right? And another was to continue to work on some of the primary health care that has happened before. So just to say, encouraging conversations, as Liz pointed out, on our way forward.
Great. Well, thank you both so much for joining us today. I'm not seeing any other questions. I know, Liz, you said you can follow up about any specifics if folks have questions. But again, thank you both so much for being here. We appreciate you taking time to speak to our champions. I know they always love hearing from you. And again, tonight at 7 p.m., we'll be doing a deep dive into our asks in Congress and how to talk about vaccine misinformation. So we hope you're all able to join us. And again, if you have any problems accessing the platform, accessing any of the videos, please let me know and I will try to help you work it out. So thank you again.
Thank you so much to all of you. Really one of my favorite parts of my weeks and months. Your work is so hugely appreciated. So happy to have the conversation. I apologize for my video.
Thank you. Can't win them all. It's all right.
Okay, thanks. Bye,
Thank
everyone.
you.
Thank you, everyone. Bye-bye.